Thanks to everyone for joining us this morning. So it's my pleasure to introduce my guest, Dr. Kelsey Ufholz, who is a research scientist within the Department of Family Medicine and Community Health at Case Western Reserve University School of Medicine. Kelsey is also a mentee of mine and a co-investigator in the UH Advanced Center. Today, we're going to be speaking about one of our demonstration projects, which deals with unintentional weight loss, also called abbreviated UWL or IWL, involuntary weight loss. And we're going to give you an overview of the problem as well as the project that we've undertaken, as well as some of the early findings and next steps that we would be taking from this point forward. So I'm going to be asking Kelsey a lot of questions I should know the answer to, but nevertheless, I hope it's an informative discussion. So thanks for joining us, Kelsey. Um, so I think we can start off by, you know, asking you, what is UWL or unintentional weight loss?
Okay, that's a good place to start. And one of the best ways to define that is actually by contrasting that with intentional weight loss. So, a lot of people are familiar with that. Intentional weight loss is when a patient will make lifestyle changes in an attempt to alter their body composition and shed some body fat. This tends to be a very slow and difficult process for patients or for anyone trying it. In contrast, unintentional weight loss is something where a person finds that through no effort or through intentional changes of their own, they are suddenly losing a large amount of body weight in a short time. And it's especially alarming because instead of just losing fat, lose both that and skeletal mass, which has its own host of health problems.
Well, thanks. Are there any specific criteria for how much weight people would lose, that helps us define unintentional weight loss?
That's a pretty good question, and the answer to that is there really isn't. There are some benchmarks that are commonly used, such as 5% of total body weight within 6 months or 10% within 12 months, but none of these have been evaluated clinically until our project, and that found that a lot of these criteria, um, which one you use, 5% versus 10%, 6 versus 12, don't make that much of a difference. So maybe a good benchmark would just be the one that's most common, 5% in 6 months or so.
Okay. So, you've hinted at this being a really important problem. And so I'm wondering what are some of the underlying causes we ought to be concerned about? And what's the focus of our project?
Well, there are a great many underlying causes. Unintentional weight loss is a pretty common problem, especially in older adults where it could be up to, say, a quarter of them who are experiencing this. And part of that is because it can be a symptom of so many things. Some are purely biological, such as cancer diagnosis. Unintentional weight loss is actually a very common early symptom of cancer and quite frequently the only early symptom. It could also be other biological causes, such as a gastrointestinal problem or uncontrolled diabetes. It could be a symptom of a more emotional or psychological problem, such as changes in weight are associated with depression and eating disorders, of course. But it could also be a problem of environment or social problems, such as an elderly person who has limited mobility, so they can't get to the grocery store or prepare food for themselves, or food insecurity, where someone just no longer has access to the nutrition they need. But for the purpose of our project, we were focusing more on cancer because that tends to be both a very common underlying cause and one of the more serious causes where early detection is critical.
So that's helpful. So I think the message that we've been trying to send out is, and you hinted at this, is if there is unintentional weight loss, it is a problem. It may be a psychosocial problem. It could be gastrometabolic. It could be uncontrolled diabetes with catabolism. It could be malignancy. So given its importance, how well are physicians doing in recognizing and managing this issue?
Very, very badly, actually. Our initial response found that when unintentional weight loss was noted in, like, for example, weights are very commonly recorded in the electronic health record. So theoretically, physicians have all the knowledge they would need to monitor changes in weights. And of course, patients often self-monitor this themselves. But even when a large amount of weight that would reach one of our criteria um, was evident in an appointment, physicians only noticed this, our sample found about 38% of the time. So not a very large amount. And yes, like you indicated, no matter what the underlying cause is, it tends to be a very serious indicator of a problem.
So why are we doing so poorly? What are some of the reasons for that?
Well, a lack of a clear criteria could certainly be part of it. Just the fact that unintentional weight loss might not be one of the things that people looked at. If somebody who is medically frail comes in, they might have a very long list of problems that physicians are looking at. And so unintentional weight loss is just further down the list. Another theory that I have is that so many patients these days are overweight, and providers will spend so much time talking to them repeatedly. You need to lose weight. Um, it will help you with heart disease, diabetes, so many other things that when weight loss does occur, they don't immediately question them about how the weight loss occurred. Was this voluntary weight loss that happened through healthy means, or is this unintentional weight loss that could indicate a problem?
Yeah, that's a really good point. So, more than two-thirds of American adults are either overweight or have obesity. And, I can see an encounter where there's a number of chronic issues that I'm dealing with, and the patient happens to have lost 10 pounds in a few months, meeting the criteria for unintentional weight loss. And yet I make no note of it with the patient, but I make note of it in the chart and say, hey, it has lost weight as a good thing. But you're right, it could be completely unintentional, and it could reflect some of the underlying problems that you had mentioned before. So let's move on to our project. Can you tell us a little bit about our project and its goals?
Yes. Our project's goals were to look at a few different things, such as how common was unintentional weight loss, what were some of the underlying causes, and when unintentional weight loss was noted, what were the diagnostic procedures that physicians used, and how often were these procedures effective in leading to an underlying diagnosis? The goal being to come up with some criteria or just a series of steps that providers could use for when they noticed unintentional weight loss. So we did this by gathering information from the electronic health records at our hospital system, university hospitals. We looked at a 5-year period where participants had at least 2 weights, and we wanted to see if there were, um, we wanted to see how many patients lost weight enough to meet that criteria. It was about 3%. How often it was noted, not great, about 38% it was noted. And then within 90 days of the unintentional weight loss being noted, what tests were ordered by their providers. And obviously, in tests ordered within 90 days, it could be that they were ordered because of an entirely unrelated symptom, but that still gives us a little bit of guidance.
Yeah, thanks, Kelsey. And I would add that it's very difficult to figure out what a physician is thinking when they order diagnostic tests. So, and you may not make a note of it. Sometimes a diagnostic test is ordered simply to rule out a condition that you have a strong suspicion doesn't exist, for example. And so we use that time frame of 90 days because that's a time frame in which you would have ordered a test in association with a clinical problem and evaluated the result. The other thing I'd point out, and we haven't gotten to the findings yet, and we'll get to those, is the vast majority of cases of weight loss are intentional. So if you look in the electronic health record for terms such as good job, losing weight, dieting, exercise, etc., we find that represents the vast majority of cases of weight loss. So unintentional weight loss is relatively uncommon. So, Kelsey, perhaps we can talk a little bit about what we found.
Well, what we did find was that, first of all, it was fairly common for providers just to take a wait and see, watchful monitoring approach. And that might have been fairly warranted because quite a few patients with unintentional weight loss, I believe around 46% would regain the weight at some point, which indicates that whatever the underlying problem was, it resolved itself. We also found that as far as tests go, they were all over the map. There did not seem to be a systematic approach to them. And we found that for the most part, a lot of the tests that were used, if we would compare how often a patient with unintentional weight loss would have a test that would yield an abnormal result versus a patient who did not meet that criteria would have a test yielding an abnormal result, it was very similar. So when the tests were not particularly useful, for example, colonoscopy was one of the tests that was quite commonly prescribed, but when the results would tend to find either nothing or something benign, such as polyps that would not eventually become cancerous.
Yeah, so I think that's a great summary. And if I could just recap just exactly what you've said. I mean, what we found essentially is that, as Kelsey said, a wide variety of diagnostic tests are ordered. These are laboratory tests, imaging tests, endoscopy, and the rate of abnormal findings among those tests among patients with unintentional weight loss was no different overall than the rate among people without unintentional weight loss. And we didn't find a whole lot of cancer at all among the patients that we saw. So based on that, which was, I think, a little surprising, and I mentioned this many times, I am one of those physicians who's pretty alarmed when I see, especially an older patient, let's say 80 plus years of age, who's lost 5–10% of their body weight in a relatively short period of time. What recommendations preliminary recommendations can we make about how to evaluate this problem diagnostically?
Well, the first step would be to determine how the patient lost weight, if they were doing it voluntarily or involuntarily. So that just means simply asking the patient, like, I've noticed that since your last visit, you've lost 20 pounds. Can you tell me a bit about that? And based upon that, you find out if they've even noticed the weight's been lost. Were they doing it on purpose? And if it's voluntary weight loss, that can also lead to a conversation about weight loss methods. You want to ensure they're doing it in a sustainable and healthy manner, since the internet and social media has a lot of strange diet trends. If you talk to them and they determine that it's not voluntary weight loss, the next step would be a very, very careful review of their history and for other symptoms that might lead you towards one of the underlying causes of the weight loss, such as are they having gastrointestinal problems that might lead them to you to think it's a problem in that area? Are they experiencing symptoms of depression? Are their dentures not fitting properly? And from there, you would target your laboratory tests uh, based upon ruling out or confirming a preliminary diagnosis based upon those symptoms.
So let me stop there. So I think that if I can summarize a little bit of what Kelsey's saying, first of all, it's exceptionally rare for a patient to present to a physician, to a provider with unintentional weight loss. Oh, I'm losing a lot of weight and I can't explain it. That would be very strange, indeed. So what we are advocating is a fairly conservative approach. And I think the open-ended, you've lost 15 pounds since I've seen you. Tell me more about that. I think is the best way to get at whether or not this is intentional or unintentional, or maybe that might solicit responses such as I've lost my appetite because my mood is really down and I'm not sleeping well, in which case they're depressed, or yeah, the grocery store next to my senior's apartment building just closed down and I have more trouble getting food. So it may lead to some meaningful inquiry. And then what Kelsey's suggesting is that you do a review of systems to look at symptoms consistent with unintentional weight loss. Um, so a very conservative approach. Are there other recommendations, Kelsey, that you would make in terms of watchful waiting or anything else that we can tell?
Yeah, because cancer is such a common underlying cause of unintentional weight loss, and because that's one of the more serious causes, another thing you could do is look through their chart and see if they're up to date on their routine cancer screenings, depending upon what they might be at risk for, mammogram, PSA, lung cancer screening. And then if there aren't any further tests that you have in mind, at the very least, recommend that the patient begin monitoring their weight, weighing themselves at least once a week, and then seeing, does the weight regain? Do they lose even more weight? In which case you would want to bring the patient back and start doing further testing, see if new symptoms have developed.
Yeah, so I think what we're saying then is that do not shoot in the dark with a lot of invasive procedures. Not every case, but most cases of unintentional weight loss are in older Americans, and so to subject them to endoscopy imaging that's unnecessary wouldn't be the most appropriate course. But what we're saying, I think, is that there are routine cancer screening recommendations for colonoscopy, for low dose CT scanning among people with the appropriate smoking history, mammography, of course, PSA, and discussion with the physician in terms of shared decision making, whether there is a family history and other risk factors for prostate cancer. Those are all the appropriate things to do, but randomly investigating for underlying malignancy is probably not appropriate. The other thing that Kelsey mentioned is regular self-weighing and monitoring as well. Um, Kelsey, we've presented these findings and a set of recommendations to our diagnosticians panel. What do you see as our next steps going forward?
Well, we would want to codify these steps a little bit further, see if we can make them practical for our people and individuals. The diagnosticians panel did recommend that we try to figure out what do you do if there are no symptoms and even 6 months later there aren't any further symptoms. We worked with one sample at one hospital. It's possible that expanding this to a wider population would yield further results. That's always a possibility.
Yeah, so our diagnosticians panel is a very diverse group of healthcare professionals who are weighing in on our set of recommendations right now as we speak. We're in the midst of that process, and then we'll go on to endorse our recommendations with the board of advisors from the UH Advanced Center, and we have a publication in the works as well. The dream that I have, and I think Kelsey would agree, is that we want this to be part of clinical decision support within the Epic electronic health record, which alerts clinicians to unintentional weight loss and steers them in the right direction as well. I think one of the things Kelsey hinted is that sometimes, and our diagnosticians panel hinted at, is that sometimes weight just decreases and there is no underlying cause and there are no symptoms and it stays at a certain level. It's important to understand the natural variation in human body weight, which peaks in both men and women around age 35, age 60 rather, and afterwards actually starts to decline a little bit because of loss of muscle mass in particular. So that's a natural process that happens. So that's not something that should be alarming, but it's a relatively slow process. But in some cases, we may not find a cause at all, and it's more appropriate to monitor those patients rather than to investigate them diagnostically with a number of tests. Kelsey, I think what we can do now with just a few minutes left is turn this over to our group to see if there are any questions from anyone.
This is Mary Delansky. Hi, Kelsey, and welcome. This is excellent work. I have a question on the diagnostic excellence and the systems approach. It seems like a possible opportunity for future research or inquiry into maybe getting consumer-driven input or integration of this, maybe using the my chart to let the patient know, look, it looks like you've lost greater than this amount of weight, and it would be good to talk with your physician about this as another maybe approach for the phenomenon. And I understand that people may be afraid because as a baby boomer, my whole life, we've been told, oh, if you lose weight and unintentionally, it's cancer. But it sounds like there are some other, possible reasons for loss of weight. Well, wonder what your thoughts on more of a systems approach might be.
Yeah, I can start. And so terrific comments, Mary. I think that first of all, you're absolutely right. One of the drivers of low rates of lung cancer screening with low-dose CT scanning is I don't really want to know if I have lung cancer or not. I met a patient a couple of weeks ago who had that same response and actually wound up having small cell cancer of the lung. So sometimes people don't really want to know because of this fear of malignancy. I think a patient-driven approach would be helpful. Keep in mind, a lot of these folks are older. They are not my chart savvy. So Kelsey has a lot of experience with older folks in technology and telemedicine. Sometimes they may have a proxy who can help out, but it would be wonderful to say, "Hey, looks like you've lost a significant amount of weight. Can you tell us more about it?" So in other words, they go to dermatology, or they go somewhere else where they just happen to be weight and the weights are different. And it may just be, yeah, I'm trying to lose weight, or that's weight is not accurate, whatever it is, but you might get a meaningful response. But definitely something we ought to try. Yeah, Kelsey, any comments about that?
I would just agree that bringing the patient into the conversation is very important because if you're doing weekly self-weighing, with 6 months time frame between appointments, the patient is very likely to notice things first as other symptoms develop. And if nothing else, this will lead to closer collaboration between the provider and the patient, which is always a good thing.
Yeah, and I think just to reiterate that, I think weight is a very, very important marker of overall health, whether people have obesity or overweight or just have a normal weight and happen to be losing weight. So self-weighing, at least on a weekly basis, is something that we would recommend for everybody, regardless of their age and health status. Any additional questions before we wrap up? Okay, well, thank you, Kelsey. Thanks to everybody for joining us this morning. I hope that was an informative discussion. As Kelsey indicated, we have some additional steps in this particular research project, and we look forward to sharing our final results and recommendations with everyone within the next couple of months. So thanks, everyone. Have a wonderful day.
Thank you.
Thank you.